Hello, everybody. Good evening on a very hot, late afternoon or evening. And I hope everybody is keeping themselves hydrated and safe from the sun. My name is Subash. I'm a clinical pharmacist, very big interest in ophthalmology. And I have been a member of and a very good friend of Bhavini, as well as with London Vision. Today's presentation actually it's a sort of a joint one which we have prepared with my dear friend and a member of BME, Jayashree, but unfortunately she has been occupied with what she has been doing. She's in the train at the moment. Hopefully she reaches home and she probably might join us at some point. So what happened is over a period of so many years, we have found there is always an issue about eye care and eye health.
तो इसीलिए रिश्तों को संभाल कर रखना, उनको अच्छे से उनको
sorry, can we mute? Sorry, go ahead.
So what happens is, it is very surprising, and which I found out, and you'll probably all of us will agree that one of the most important part of being what we are is our eyes. We perceive everything, we see everything, we experience everything, and it is through the eyes. But we are so careless that unless and until a speck of dust gets into your eye, till then, we are never, ever careful about the eyes. And this is actually, this talk is going to be, there will be a presentation on slides, but this is going to be, as Bhavini knows it, that we do it, it's a very interactive sort of a talk. So after my talk and presentation is over, we will have a question and answer session. And I'll try to answer it to the best of my abilities. And hopefully Jayashree will be also joining us, so she will also participate. So we start. I'm going to share my screen now. Right. Okay. Right. Now, eye health. We always, when we start this presentation, we always say, what is it actually about? What do we mean by eye health? And this is what we actually, two of us, Jayashree, whom you see on your left side screen, and myself, we over a period of time, we kept on thinking about it, that what is it that prevents people from going for an eye health checkup? And we discovered among two of us, and then we started asking questions, and the BME committee, as you, Bhavini, is our chair, and we started finding out what people were, why they were afraid, why they were not going, and what is the reason of what should be doing. So this is which we came about. First of all, who we are. We are the BME people. We are both members of the BME Vision Group, and BME is Black, Asian, and Minority Ethnic Group. And London Vision is actually, it was started and it is very active in actually passing enough and adequate and further information about eye health. This is what we are. Our aim is to highlight the importance of looking after our eyes and attending appointments and taking precautions to maintain a good eye health. And we all of our members, we are very passionate about our eye health and eye care. And we sit on different committees, etc. But we have won awards as well. But what is award? Award is, I think it is a recognition of what we are doing, but that message has to be passed on to actually the people who really, really require it. Now, so here we are. 2 million people are living with eyesight loss in the United Kingdom, and sight loss that is significant enough to make an impact on our daily lives, because we all know that the moment we have vision problems, it affects our complete life. And there's a lot of adjustment has to be done, lots of things need to change, and we can change this by having an eye examination and getting diagnosed earlier. This is very important by making changes in our diet, environment, lifestyle, and by raising awareness about the eye health. This is exactly what is needed, and everyone has to understand this. Eyes are the window to the soul and your health. I'm sure that, when we meet a new person or when we meet anybody, the first thing we always look into people's eyes. I mean, I understand one thing, that if there's a fear complex and we don't look into people's eyes, that is also, it happens. But the eyes are always a window of what a person is. And likewise, eyes are also a window to quite a number of health issues. Now, onset of many health conditions is very, very gradual. And people just don't realize it. Now, this is where the eye examination becomes paramount of importance. For example, glaucoma is one of the conditions where a patient loses partial eyesight, that is peripheral eyesight from the side. But because both the eyes compensate, and as well as the brain compensates for the vision loss on that particular side, it's a complex thing. But people think that they see everything is fine, but there is a vision loss. Say, for example, if the vision loss is lower vision loss or the side vision loss, I have seen people bumping into things because the brain tells them everything is fine, but it is not fine because the vision loss is there. Diabetes is another among the Asian, not among Asian, everybody actually who suffers from diabetes. And diabetes screening is very vital. So once a person with diabetes has been diagnosed, that you get every year, you get a request or you get a letter for your diabetic screening. And we found quite a number of people miss that appointment, which is not very correct, because diabetic screening, that retinal screening, is so important to find out whether the eye health is stabilized, it is proper, and it is not progressive. So that is one thing. High blood pressure, high cholesterol, that also can be diagnosed. Age-related macular degeneration, which is as people advance in the age, macular degeneration happens. It is also genetic as well. And if it is caught early, it is always very important to remember any disease caught earlier gets better attention and quicker response for the treatment part of it. Glaucoma is another one. In United Kingdom, we have got more than nearly 750,000 suffering from glaucoma. And out of them, I mean, if you look at it, and I'm working in that field, nearly half of them are underdiagnosed or not diagnosed at all, because people think it's every fine and they don't go down to the eye traced optician to get eye examination. Retinitis pigmentosa is another one. So, there are quite a number of eye issues and health issues which can be actually diagnosed by regular eye examination. Now, list of another conditions which we found out and we picked up during the comprehensive eye examination. I'm going to talk about eye examination, what happens there as well. But these are the things which your optician and your your optician picks it up in the first examination. For example, aneurysm, brain tumor, diabetes, lupus, stroke, Lyme's disease, multiple sclerosis, rheumatoid arthritis, Sjorren's syndrome, thyroid disease, vascular disease, Alzheimer's. So you can understand that a comprehensive eye examination actually can find out quite a number of issues which are present, which will be missed otherwise. Well, age-related macular disease has been quite a number of in discussion at the moment, like glaucoma as well. It doesn't cause total blindness. We will be having future programs, will be discussing each disease area separately in a presentation again. But this is just a brief outline which I would like to give it to you to make you just understand the importance of knowing after the diagnosis has occurred and the treatment which follows. So doesn't cause total blindness. In age-related macular disease, the people or the person loses the central vision, unlike glaucoma, which loses peripheral vision. So, and without treatment, the vision gets worse. Exact cause is unknown, but there are lots of help which is available, which we will be discussing in future seminars. Right. During the pandemic, actually what happened was during the pandemic, since it was about 3 years or 4 years, when I think it was 2020 when it started, hospital appointments got cancelled. People were worried to get out of the house, couldn't go to the hospital, appointments got cancelled. So we started working with a group of people called COVID infographics. Brilliant group of people. They're a group of doctors, medical students, volunteers. And we created infographic to help summarize the key points about COVID-19 in a variety of languages to get the right information and easy to understand format. And in that, emphasis was really, really given onto the eye examination and what needs to be done. Now, when we think about eye test, we're talking about what happens, what are the myths around the eye test, and what do people internally feel when we talk about eye test. And this is what the whole group of people, where there are opticians, there are ophthalmologists, there are eye doctors in that, there are pharmacists in that. And we all got together and found out what are the inhibiting factors for people not going consciously to have an eye test. First of all, my eyesight is fine, so I don't need to have an eye test. Now, if I go for an eye test, I will end up wearing glasses. My optician probably might sell me the glasses, which I may not need. Second thing, I've heard they do a puff test. They throw air at the eye, and that scares me. Now, what if I get the wrong answers during the eye test? Another, if I wear my glasses, my sight will become worse. This is very common. I've come across people. They get their glasses, they don't wear it. And actually eyesight gets worsened. So when they use the glasses, they are actually not the right glasses for that particular moment. I'm scared of having an eye test, and I don't want to be told that I have an eye problem. Now, this again is a very common factor. People are really afraid that if it's an unknown thing. If it is unknown, I'm fine. If I know it, I'm not fine. So again, this needs to be understood and handled it very carefully. The eye test will only be able to tell me about my eyes and not about my general health. Again, people are, in earlier slides, I did tell you that eyes and actually it's a really, really window for quite a number of areas which doctors can identify. The disease area can be identified. And it is not only the eye test actually gives a very in-depth knowledge about what's right with the people, or maybe there's something askew in that person. Need not be afraid about that. Can my child have their eyes tested even though they cannot read letters? Yes, of course. The whole eye examination for children has been designed extremely child-friendly, and there is no issues at all. Now, if I go to A&E due to my eye problem, will I catch COVID-19? This actually came up much more during, when we had a severe pandemic going on. No, the A&E and the hospital had taken absolutely brilliant care to see that no patient would be infected during the eye examination or going down to the hospital. Another thing is, even today, when you land up in a hospital, all precautions are taken, all safety measures are taken. And even though the government has said that please don't wear your mask, it's not necessary. But believe you me, mask is absolutely necessary when you go into a crowded place. I recently went for my blood test in the hospital. I put on my mask, as simple as that. What prevents me from doing that? I go to the supermarket, I put on my mask. What prevents me doing that? It is our personal safety thing. Now, Another thing is, if my vision is bad and I drive, will my optician report me to the DVLA? This is a very tricky one. Would you like to drive a car nearly 1.5 ton on the road where you're not able to see things? I think that needs to be understood as a person. And especially people who have lost peripheral vision or central vision in both the eyes. Remember, it is in both the eyes. Then it is imperative that it has to be informed to the DVLA. Then there are tests again to see that the person is capable of driving. And if the glasses or the spectacles or eye adjustment is needed, you just have to get the glasses and everything should be fine. So all these things that we came across and we started talking to people, and especially our BMA community, and the response has been really, really very good, because we believe at BME group or London Vision group and BME group, we believe that information, education, answering questions, asking questions is one of the most important factor of getting the right information and get it sorted out. Right. Now, who is eligible for eye test? This is a brilliant composition which my friend Jaishri has done with the group as well. Now, an eye test is a vital check on the health of the eyes and includes the detection of eye conditions. Many of these, if found early, can be treated successfully, avoiding patients' sight loss. This is extremely important to understand. Why do we go for an eye checkup? And the recommendation is at least once in every 2 years. We must have it. That includes our children as well, if it is found out. Now, who is eligible? Now, anyone under 16, age 16, 17, 18, and in full-time education, they get free. Any person age 40, and if your mother, father, siblings, or child has been diagnosed with glaucoma, it is free. A prisoner on leave from prison. I hope there's no prisoner here, but they do get eye test free, are eligible for NHS complex lens vouchers, and your optician can advise you about this as well. Anyone registered partially sighted or total vision loss have also been diagnosed with diabetes or glaucoma, get a free vision test. So you're also entitled, you or your partner are dependent or receive income support. So there are quite a number. And the best person to guide you about this is your optician, number one. Second thing is also your ACLO. Have you heard of ACLO? ACLO are eye care liaison officer in most of the hospitals in London, as well as quite a number of other hospitals. They are very informed people, will be able to give you all the direction with either the sight loss, partial sight loss, what is available, where to go and look for it. And luckily, Jaishri also is now one of the ACLOs. And so I think in future, we might have a separate session on the importance of meeting up an ACLO and getting the right type of information. Now, what happens during an eye test? We are coming to the nitty-gritty part of it. Check the level of your vision, and if you need spectacles to correct your vision. So this is first thing they do it. You know, when you go in an optician for your appointment for an eye checkup, they take your history first. So they take about your medication, what you've been on, and they note all these things. Then there's a discussion of your age, lifestyle, and medical history. They do. They look for signs of injury, disease, or abnormalities in and around your eyes, if it is there. Then there is a retinal examination with the slit lamp, and now they do OCT. OCT is ocular computer tomography, and it's a scan which is really very important now because it gives the complete picture of the back of the eye, of the retina. And if there is a slightest or the minutest change in that, the OCT can catch it. And it is now very prevalent with all the opticians now. The puff test, the pressure. Now, we must understand that difference between blood pressure and eye pressure. Now, blood pressure is something to do with the heart. It pumps the blood around, and that is our blood pressure. Eyes do have a pressure. For number one, to maintain the shape of the eye. That's one. How does it come through? It's a very simple but a complex situation there. It's like, standing before a kitchen sink. You open the tap and the water comes out and it goes to the sink. But at some point, there is a level of water which rises up in the sink before it flows out. That thing is called pressure. Now in the eyes, there is if you look at the eyes diagram, there is an organ called, or not organ, there are ciliary muscles, or ciliary muscles, which produce aqueous solution or watery solution, which contains oxygen, it contains fluid material to keep the eye healthy. It comes in the front, washes everything, supplies everything, but likewise it has to go out. It goes through what we call is trabecular meshwork. So this coming in, going out, and in between, that is eye pressure. Normal pressure is considered about anything under 20, anything about 21, 20 is considered a little bit higher, and then the examination takes place. So this puff test is very important. It's just this bolt of air which is thrown at the eye, and the eyeball, cornea goes in, comes out, and that pressure event. These machines are really, really very accurate. However, when you go to the hospital, they do another eye test, pressure test, and that is very sophisticated, and which is called Gonoscopy. So all the vision is checked, and then we go through what we call a visual field test. People are quite afraid of it. People don't like it, but it's not actually a test, I would say. It's a 5 minutes of eye examination, which you are the participant. You sit before a machine, you look through comfortably, you look through, and there is a white dot or a light, center light. You have to concentrate and keep on looking at the central dot. Then there are flashes of different intensity of the light all over that screen. You don't have to look at them. You have to still keep on looking at the central dot, and your eyes will register the flashes, which will be intensity might be high, it's low, and it goes all around. When you see that, you click the button. Now, I know people sometimes, just become trigger happy and click on. Doesn't work like that. The machine is very smart. It knows that you have actually missed it. Don't worry about it. But this is a very important part of the visual examination, because it gives your doctor an idea if there is any vision loss, peripheral or otherwise. I get it. I know, just to understand how the patient feels, I get it done. Go down to my friendly ophthalmologist when I'm working in the hospital. I sit down and do the visual field test for 5 minutes. There's a lot of advances which are taking place in that. University of Central London, with collaboration of Murfelds and Professor David Crabb, his team is developing a eye catcher program, which is in the second phase of trial now. It's really, and you can use this program on your iPad sitting at home or on your computer screen. And you need not be clicking the button. Of course, you'll be seeing and pressing the button, but it is at home, and it is in a very, very accurate way it has been done. So make a list of medication when you go down to your optician for an eye check. Very important. They should know what you're taking. If you're wearing spectacles, please take your spectacles as well. Or if you're using any low vision aids, please take them, because your optician then will know exactly what you have and probably what might be needed to have in further. Tell the optometrist or optician beforehand of any conditions, like if you have a little hearing problem. Dementia is coming up quite a lot, and I had attended a number of conferences in the last 6 months where dementia and eye examination has been correlated, in the sense that people with dementia need to be very carefully advised and also looked into their eyes as well, because quite a number of things can be picked up from there. So these people or your optician can plan the test longer and the appointment time if needed. And for example, a patient with learning disabilities or dementia of hard of hearing, then we do require a time to go through the examination. Okay, people worry about patients can't letters on the chart or lots of different ways of access vision. These charts are actually designed, for children. There are figures, there are pictures, so doesn't have any problem with patients, and they're very friendly in the sense the children are actually made very enthusiastic about looking at things as well. If as a carer you need to highlight the signs of change of behavior, if this we have come across also, because sometimes carers do recognize people's disability or problems with their eyesight. So when they are accompanying for an eye examination, they can help that out as well. Then consider diagnostic overshadowing. This can occur when a healthcare professional assumes that a patient's disability is due to their disability rather than exploring fully the cause of the patient's symptoms. I mean, it is basically looking at the patient and finding out exactly how we can help them with an eye examination. Okay. Children and eye test, especially for myopia, this is a big worldwide problem, common amongst growing children. Blurred distance vision, if left uncorrected, possible increased risk in later life to retinal detachment, cataract, and glaucoma. New treatment options are available to help slow down the myopia and includes contact lenses, especially spectacle lenses, and drops. Ask your optometrist for more best option. Now, for children, it's an extremely good setup in the hospital, even with the optician, and they're extremely friendly environment. Now, how can we find out whether the children have eyesight problem and all that? And one incident with Jayashree had told me about it, and she likes to talk about it, was, when children were playing a game in the school. So you close one eye and spot what you're looking, and then close another eye and spot what you're looking. And one of the girl came back home and said, "Mom, when I put my hand on my left eye, I can't see through my right eye." Now that really, rang a bell, and the child was taken to the optician, eye examination was done, and the only thing what she needed was an adjustment of having a spectacle to adjust the eyesight. So there are quite a number of things which can be detected. And sure, again, we always keep on harping about this for children's visual learners. Ensure regular eye examination to monitor the eye condition. NHS funded eye examination for children. It's free for all under 16 years of age and under 19 on full-time education. Now, who are involved in optometry? We have listed all the 4 branches. All these branches will be discussed in further seminars. So I'm going to skip quite a lot here, and I'm going down to the optician part of it. This is where our first interaction takes place. So there is optician. It starts like from the bottom top. So optician is first where you go. Then there is an optometrist. Then there is an orthoptist. These 2 people you'll find in your local optician or in the hospital, and the ophthalmologist is the consultant surgeon or the doctor, which you'll find in the hospital. So I'm going to skip this because it will be very important to know every faculty in depth when we talk about it. So optician, orthoptist, I've told you about it. Optometrists are trained to examine and detect defect in the vision. And dispensing optician. This is a very important part of our eye examination as well. Now, dispensing opticians are trained to advise and fit glasses according to a person's prescription provided by the optometrist or specialist ophthalmologist. They are highly skilled in offering advice on lenses for specific purposes, such as night driving, UV protection, or sports and safety wear. Now, I wear glasses. I've been wearing glasses since I was 15 or 16. Never had any problem. I always get my eyes checked every 2 years. If there is any deviation in my refraction, probably the glasses might like to be changed. So very important, if you get the glasses, very important to wear them. Dispensing spectacles to children as well, they do it. For visually impaired, they do it. Or they dispense contact lenses as well, and can only be undertaken by carried out under supervision or a dispensing optician. So it's a very highly professional way of advising. And believe you me, they will not sell you the spectacles if it is not needed. So we should not have that fear. Now, there are 3 C's of spectacles or glasses. So first of all, we must remember, are your glasses current? Are your glasses clean? And are your glasses comfortable to wear? Very important thing. Now, Jayashree always keeps on saying about this thing, are your glasses correct? People go down to the supermarket, pick up those glasses, which are £2.50 or £1.50, reading glasses. Okay, they're fine, they're cheap glasses, they help you to read. But actually speaking, there should be proper eye examination, get the right prescription for those reading glasses as well. Otherwise, those wrong prescription or wrong focal length of that particular glasses is going to do more harm than help you out. Are your glasses clean? I have had a friend, and she told me she was not looking properly through the glasses she was wearing, and she was very worried. So I said, okay, let me have a look at your glasses first. And believe you me, they were all smudged with the oil, because when you pick up your glasses, you pick up with your finger, and there are smudges on it. So clean glasses are extremely important as well. And they should be very comfortable when you wear it. Please do not have those glasses which they look beautiful, but don't fit perfectly. We prepared this eye health, taking good care of your vision. Optometrists recommend that most people should get their eye tested every 2 years, which we just talked about it. And during the pandemic, what happened was that all these opticians, they started having domiciliary eye test, which was really a great boon, because a qualified person came with all the equipment for the examination at your home. So if you're disabled, if you can't get over it, please see that you can ask for a home visit. Diet is also very important. I mean, vitamin A, D, E, K is very important. We get it from green leafy vegetables. If you're non-vegetarian, if you can eat eggs, that's fine. Fish is fine. If people don't eat fish or are vegetarians, you can pick up good capsules, mineral capsules, as well as omega-3 capsules from a good, like Boots, and yeah, they do really good ones. So you can pick them up from there. Smoking is always a big problem. Smoking does cause eye issues quite a lot. So it is better people actually desist from smoking, leave smoking. Very big thing to ask, but it is very important. And it also raises, smoking also raises intraocular pressure as well, which has been found out. Exercise, yes. Every day, having at least half an hour of good walk is very important. I know we live in our country, either it's very cold or now it's very hot, you can't go out, but at least when it permits, at least you can do a couple of rounds in your home, go up and down the stairs, walk around from kitchen to living room and back. So it's very important to have that exercise. It is sunny, bright outside. Sunglasses are extremely important because we live in the northern hemisphere. We've got high ultraviolet rays, so it is very important that we should be having a good sunglasses. And people who do DIY, it is very important to have safety glasses as well to protect the eye. Eye health care is for everyone. No one is too disabled to have an eye test. Domiciliary service available if you cannot access the high street practice, and the people will come to your home all with all safety measure, all PPE, and your eye examination will be perfectly done at home, and then good advice will be given. It's like dental check, which go every 6 months or so. So they should be actually a routine part of our health check every 2 years, and as often as your optician advises. Remember, eyesight can change over time, so early intervention is the key. If registered sight impaired, it is still important to have regular eye tests to make best use of sight you do have, and to speak to the ear care professional about any new conditions, any relevant research services that need to know about. There's a huge amount of research which is going on, and in fact, you get every day, every couple of weeks, I get to go to read quite a number of articles which are very, very important in medication supply, how to apply it, new surgical procedures and everything. Pandemic and its problems, working from home, hybrid from home and work. And this is what we found out, that it increased screen time when it's out of 24 hours, nearly 11 hours. Then that includes your smartphones, computer usage, and television. I have stood before recently, I mean, always I ask during the meetings, when you get up in the morning, what do you do first thing? Believe you me, the answer is pick up the phone and have a look at the messages or WhatsApp or whatever it is. And that how it starts. And during the day, like right now, we are on the computer, you're on your iPhone, you're on iPad, then we have a TV. And what has resulted in that is our blinking rate has dropped to 50%. Now, when I call about blinking, it is very important. Every blink you do, your eye produces a clear film which cleans the eyes and soothes the eye, which is very important. So when you keep on staring at your screen or TV or your iPhone, your blinking rate drops and your eyes become dry. We will be having another session on dry eyes as well. But what it causes is burning, redness, watery eyes, inflammation of the eyes, and blurry eyes as well. So those are dry. So be screen smart. It is a rule of 20-20-20. Make sure you minimize the symptoms of screen fatigue by following these rules. What it is, look away from your screen every 20 minutes and focus something about 20 meters away. I mean, when I work on my computer, I always look out of the window, look at the form at the back for about 20 seconds, and don't forget to blink, and don't forget to drink water. Hydration is extremely important to prevent your dryness of the eyes. Taking good care of your vision is extremely important. So we are nearly there. Eye hygiene, the last one. Wash your eyes with warm water whenever you go to your washroom, and it helps. Close your eyes and very gently with warm water from eyebrows to downwards towards your cheek, paying good attention to your eyelashes, which will clear up if there is any dirt or muck or anything is that. And that helps to bring the balance of your tear film as well. And in case if your doctor has prescribed or advised you to have lubricant eye drops or what we call is artificial tears, then please remember to have preservative free, which is extremely important to have a preservative free. And to prevent the drops getting into the system, close the eye. I think we will have another session separately on how to use the eye drops. And that is my area again of, and I've been actually teaching people how to use their eye drops comfortably, how, why, and when about it. We are BME Vision Group. If you have any problems accessing any eye care, please do reach out to us at info@bmevision.org. We are interested in speaking to the community groups, and we have done it about eye health and sharing resources. So if you have got any groups, we have small groups. So for example, if we are in Kent, we have got the Gurudwara, which they invite me to give talks on eye health. We have got social Gujarati clubs here. There is, I go regularly to glaucoma patient support group meetings or macular societies and all. So all these smaller little society or even our BME group, if they have any, I've gone and spoken at East African Forum. I did it in Swahili. I go down to Sierra Leone group meeting. So there are lots of different associations which are there. And if you're a member of any group, and if you require any help in any one of us come and give a talk, please contact Bhavini or info at BME Vision organization, and we'll be able to help you out. Thank you for listening. And I think we have got enough time for questions if there are any.